Once again, a very warm welcome to the program. I am Nyasha K. Mutizwa. Now, we kick off this morning call, with an action plan to tackle HIV drug resistance in Africa. The growing resistance on the continent is threatening the significant progress made in the global fight against the virus. In an effort to end the AIDS epidemic by 2030, the World Health Organization and partners in Kigali, Rwanda, unveiled a 5-year plan to monitor, prevent, and respond to drug resistance, known as the Regional Action Plan. The scheme outlines systems to monitor HIV drug resistance indicators and how to use them at clinic and program level to develop evidence-based quality improvement for antiretroviral medicine programs. Ruth.
Well, Nyasha, an AIDS-free world is the dream of the World Health Organization, which has tasked itself with ending the epidemic by 2030. Although the organization acknowledges that progress has been made, in Africa it admits that its progress is threatened by more hesitant political will and increasingly less generous funding. In addition, HIV's resistance to certain drugs builds a dark cloud around the hope of having an AIDS-free world by 2030.
And now to understand more, Ruth, we are joined by Fatim Shamjalo, who is a PhD technical officer from the World Health Organization. A very good morning to you, and thank you very much for joining us on the program. Now, how worrisome is the situation, Doctor? Of course, we can understand that it's very technical.
Yeah, it's technical. So that's why I'm really trying to go down. So let me backtrack a bit. So before 2019, right, WHO was recommending NNRTI. NNRTI is non-nucleoside reverse transcriptase inhibitors. Those are the drugs that people have been taking, and some of them are efavirenz, nevirapine, those NNRTI-based regimens, right? So those also pregnant women were given nevirapine or efavirenz. So those were the drugs that people were taking before 2019. That is what WHO recommended. So with those drugs, we now see resistance. So that is what's worrisome. It is worrying that countries that have done surveys like in Cameroon, in Namibia, in South Africa, in Uganda, in Zimbabwe, they're seeing high level of resistance to these NNRTI inhibitors. Okay, so that is the issue. So what WHO said now is that people should stop using these NNRTI-based inhibitors, efavirenz and nevirapine, and now switch to another new drug, which is dolutegravir. It is an integrase-based inhibitor. It is an inhibitor that blocks the virus from integrating into the human genome. So that drug is now what WHO recommends. And this new drug, dolutegravir, has a high resistance.
Madam Fatima Shamjalo,
AIDS-related deaths have reduced by more than half over the past 10 years. However, you call for vigilance in your 5-year plan. Can you throw more light on this?
So countries, when somebody is on treatment, you have to monitor them. And how do you monitor them? You monitor their viral load. That means the level of virus in their blood, okay? When somebody is on medication, you monitor them. WHO says you need to monitor them 6 months after they start, 12 months after they start taking the medicine, and then every year you're supposed to monitor them. If the viral load is not suppressed, that is, if it's not below 1,000 copies per mil, then this patient has to go through adherence counseling. If the patient goes through 3 to 6 months of adherence counseling, you do another viral load, and the viral load is still not suppressed, then this patient needs to switch to a second line. If the second line can be a protease-based inhibitor, if this person was on dolutegravir, or if this person was not on dolutegravir, countries can choose dolutegravir as second line.
So, Doctor, the latest development on drug resistance has received a lot of criticism, but you seem to say that a lot of progress has been made. Could you explain further on that?
No, we're very happy about the progress, and we're just saying that such that this happiness can continue, such that the progress can go on. We need to make sure that we strengthen our health system. We make sure that we don't have drug stockouts. We make sure that we increase viral load suppression and make sure that we support patients to be retained in care such that this happiness we have will not be derailed by drug resistance. So drug resistance is it's like somebody sitting out there waiting for our systems to crumble such that it can reverse our gains. So for us not to reverse the gains that we have had, the happiness that we have had, so far with drugs and HIV, trying to eliminate HIV by 2030, we need to make sure that we monitor and prevent and mitigate the risk factors that would prevent drug resistance, that would cause drug resistance. So what we need to be doing is preventing drug resistance.
Well, Doctor, we really hope we are on our way to ending the AIDS epidemic by 2030, but we have to end that here this morning. Thank you very much for joining us on the program. That was Fatim Shamjalo, PhD Technical Officer from the World Health Organization, coming to us from Brazzaville here in the Republic of Congo. Now back to you, Ruth.
Away from that to other news making headlines in other parts of the continent.